Good morning, everybody. I want to make a quick video. But it's going to be fairly detailed. It's about utilizing a lacrosse ball, although this is a baseball, as you can see, American baseball. And this baseball is what I use to roll my psoas muscle and my anterior carriage, or the lateral part of my glute medius, or parts that get really tight when it comes to doing a lot of running or just any exercise in general. But typically when it comes to runners, there's just so much fatigue in the hips and the hip flexors, along with being like really quad dominant during the run and kind of being leaned like forward, right? You can also do this principles of interchangeably with when you're seated for a very long period of time, like most of us nowadays, through portions of the day, that our hip flexors get so unbelievably tight, which makes our posterior chain, right, our back, get very lengthened. The muscles back there get lengthened, and that puts a lot of pressure on the posterior aspect of the disc. And therefore, when the disc gets hurt, or you can get a disc bulge or a disc herniation or an acute flare-up where you actually will get like a sprain or a strain, but there might be some what we would call discogenic or disc involvement. And that's something that, again, a Gonstead chiropractor would specialize in, is caring for those disc levels, in particular, something that we're very good at and we take a lot of pride in. But one of the ways that you can really mediate this pain is through this lacrosse ball, or baseball in my case, rolling. And I'm going to take you through exactly how this works. And the way I'm going to explain it is, a tendon is something that connects the muscle, right, from bone to bone. That's the best way to think of a tendon. So the tendon has, a muscle will have two tendons, and those two tendons will attach to bone. Now, when we think of the psoas, we have to remember that the closer we are to the end of a tendon is the closer we are to a bone. And those are very, very tender spots. So if you're on it with this and it's painful, you're doing it wrong. But if you're on enough of the tendon, far enough away from the bone, and it's a very good deep hurt, like it's a therapeutic hurt, like as if someone's jamming their finger in there, or you've like got the instrument that you've ever used on it and you feel like it's a good hurt, you have to build tolerance without really forcing it. You have to progress through, and I'm going to show you how to do that now. So we'll use the left side to start off. I won't show you both, I'll just show the left. And as you can see right here's the ball. There's the pelvic crease down there. It's like, this is my bone. And there's the ball, but as you can see, it lays over, not on the bone. See, like if I went here, that's on the bone, and that's keeping me from being able to kind of cover this. That actually is a slight good hurt, but what I can do is go down into it like this. Now I'm all in the muscle, and all I have to do is passively lay in it. What you'll notice about this position is I'm actually in what we call extension. This is lumbar extension or pelvic extension. And this area here is quite sensitive for me, especially after a run, especially after standing there for a couple of minutes talking. And what I'll do is I'll just lay in this. I don't have to accentuate like by pulling my elbows in. You see what I did? I can pull my elbows in and really get that in there, which is also separating the lumbar and kind of doing something of like a modified cobra pose. I'm not saying that everybody should do this. And this is, by the way, this is very hard for people that have degenerative disc disease and for people that have what we would call like canal stenosis of the lumbar spine. This is actually quite a difficult exercise to do and can bring on quite a bit of pain. And somebody in that situation may actually have to have pillows propped up under their pelvis to kind of raise like this. But remember, we're focused on the tendons and, being on that. So right now I'm on the belly of the psoas muscle. I'm not really close to the tendon at all. I went, so the ball is up more. But if I go down, see where that ball goes down here, now I'm getting close to the tendon, the tendinous insertion, I'm close to it now, and I can really get in there and start to go side to side, up and down, and just sort of work out these little points. It's like doing a self-massage. If you're in there deep enough, you'll actually feel a referral to the opposite side of the back. You can read anatomy trains if you want to know more about that. I can internally rotate my femur in and out like this to get on other parts to kind of change the sensation and how it's affecting that tendon. And again, I can roll up into the abdomen more on that muscle belly and just affecting different areas of that psoas. The promise is that I can come up from doing a floor routine like this, and I'll just do some gentle cat-cow, as I've alluded to in a more recent video. You can see I'm watching 1883 in the background there. And so now I stand up, and that's just it. I mean, right now, much more freedom, a lot less tension in the lower back, a lot less tension in my pelvis and hips after the run. And now I can do things like ice, I can take my fish oil magnesium malate, I can do a little bit more of my routine, which I'll actually wrap this video up right now in the next minute, I promise, by just showing you this, Theragun routine, right? Right in here on in that glute medius muscle. And you get right in there through the more psoas work, just hitting it in a different way. We can get it on the quads. Yeah, back there on the hamstring group. Do we have abs coming back? Oh, we got some abs coming back. we're getting there. We're getting there. Losing a bit of fat from late September up through the end of December here. So, it's nice to get the groove back. It's nice to start feeling better. Come on, Axe. Sorry, guys. So, again, that's a big portion of the routine that I do, and that's kind of how I was able to go from, oh, I'm scared and my back is always going to flare up and I'm always so tight in my back after I run, which is still the case from time to time. And chiropractic adjustments, really, they do. When it's done right, man, they take care of that. And, not every chiropractic adjustment is going to be a home run. Not everyone's going to be the one that, gets you back on your feet and feels as good as the best you've ever had. That's the swing. That's the, that's sort of just the way that it goes. But if you can do these kinds of psoas tendon, iliopsoas tendon release and glute medius release type exercises, just remember, when you can lengthen the anterior muscles that are pulling those posterior ones long, that shortens the posterior muscles, that relaxes the back a lot more. And when you can relax the back and shorten the amount of tension on those discs, you can begin to have a lot easier time moving around and managing, actually doing the necessary exercises and or getting the care you need to actually heal a disc. And if you don't have a disc issue and it really is just a tight psoas, this may just go ahead and make you feel 1,000 times better when it comes to moving around, sitting to standing, and easier time recovering from exercises. All right, everybody, I hope that helped. And until next time, it's Dr. Pearlman.